and ladies and gentlemen, I would like to extend our sincere appreciation for attending this virtual launch of an important study on individual measure of multidimensional poverty. We call it IDM. The IDM Indonesia Country Study is part of a broader program of research on addressing poverty and inequality at the Australian National University. The IDM Indonesia Country Study was part of the Individual Deprivation Measures Program, funded by the Australian government through the Department of Foreign Affairs and Trade from 2016 to 2020. The IDM study in Indonesia was undertaken in 2018, and this, of course, after a consultation with Bappenas and CSOs, as well as local government, university like University of Hasanuddin and University of Indonesia, and a range of stakeholders, and after getting the research permit for sure. And based on the consultation, the study was undertaken in 2 districts in South Sulawesi province. Those are Jeneponto and Pangkep. An Indonesian survey organization, which is called Survey Matter, collected the data working with research at the ANU, and the research responded to local government concern about the lack of local data on multidimensional poverty, particularly for people with disability and in the island region of Pangkep. And the result of the survey will help the government of Indonesia, which is now represented by Pak Maliki, at the national and local levels to understand more about the vulnerable population and to target the right groups. And before I go on with the this important agenda, we have 90 minutes discussion, and we may perhaps extend 5 minutes to launch and discuss the IDM that will be started with the keynote speech that will be delivered by His Excellency Mr. Allaster Cox, Pak Allaster, I call it Pak Allaster, Chargé Affairs of the Australian Embassy in Jakarta, followed by an official launch by Dr. Maliki. He's one of our prominent director in Bappenas, in the Ministry of National Development Planning, Planning Agency in Bappenas. And after that, Professor Sharon, Bessell, and Dr. Angie, Bexley will go over like an overview of the study. And then we go into the question and answer session. And the Q&A will start. I will give the privilege to Pak Allaster, Mr. Cox, to start the question. And then we will take some of the questions from the audience. There are listed in the Q&A box. Now, let me start. So let us start by listening to the speech of Mr. Allaster Cox. But before that, I would really like to introduce him so that we know Mr. Cox better and deeper, like what I know now. Pak Allaster Cox, currently, as I said in the beginning, is the Chargé Affairs of the Australian Embassy in Jakarta. Previous, he was head of the Southeast Asia Maritime Division and the Department of Foreign Affairs and Trade in Canberra from 2013 to 2017. And prior to that, he was Assistant Secretary in Indonesia and Timor-Leste, from 2012 to 2013. His overseas experiences, Mr. Cox was an Australian ambassador to Vietnam in 2008 to 2012, right, Pak Allaster? And a High Commissioner in Brunei Darussalam from 2001 to 2003, Deputy Head of Mission in Kuala Lumpur from 1998 to 2000 during the difficult era, that is the multidimensional crisis at that time. Yep. First secretary, later political counselor in Jakarta from 1992 to 1996, and then the second secretary in Brunei Darussalam from 88 to 90. In Canberra, Mr. Cox has been the Assistant Secretary, Policy Planning Branch from 2007 to 2008, and Assistant Secretary, United States Branch 2006-2007. Between 2004 and 2006, he was secondment as Assistant Secretary, Asia, Americas, and Trade Branch in Department of Prime Minister and Cabinet. Mr. Cox holds a Bachelor of Law and Bachelor of Economics and degrees from University of Sydney, where he was the president of University Union in 1984. He worked for Shell Australia as an industrial economist in team negotiating workplace or manning level reform from 85 to 97. So now we know his background, his long experiences in foreign affairs, and he's one of the Indonesianists, very rare Indonesianists. And aside from that, he's also mastering all of the issues in Southeast Asia, because he has been posted in several important countries in Southeast Asia. Pak Allaster or Mr. Cox, I would like to give the floor to you to deliver your keynote speech. Please, Pak.
Well, thank you very much, Nina, for that very introduction. And I'd like to begin by saying selamat pagi dan selamat kepada kita semua. And I hope all of you are having a very good day today. I'd like to particularly thank Dr Maliki of Bappenas for being with us today, and also Sharon, Bessell and Angie, Bexley, who are going to be the two research leads who provide us with all of the insights on this individual deprivation measure of multidimensional poverty that we're going to learn about in this seminar today. So thank you to all of you for participating in this seminar today. On behalf of the Australian government, we've been very pleased to support this research, which, as Ibu Nina rightly says, is not just in Indonesia, but is in a number of countries, which provides for inter-country comparisons, which I think are very important. But we all know that in Indonesia in particular, there's been a tremendous success in poverty reduction over the last 20 years. And we've seen poverty reduced down to, in 2019, under 10%. Poverty was reduced to, I think, about 9.25%. And while, unfortunately, due to COVID-19, we will see some poverty increases in Indonesia, and I think there's some predictions that poverty will go back up above 10%, 10 to 11%, we're not sure, in 2020, 2021, 22. Nonetheless, I don't think that takes away from the large success that Indonesia has had in poverty reduction. But as I have often said before, and I know colleagues in Bappenas agree, this last 10% of poverty is perhaps the hardest 10% to see reductions in. Every 0.5% gain in poverty reduction is a hard-earned gain, which means that what is lost, even 9.25 to perhaps 11%, doesn't sound much to some, but actually it is a tremendous loss. And so these are the hard parts of poverty reduction. And we need, I think, tools which allow us to measure more effectively than ever what poverty looks like and what poverty means in a more granular way, a more detailed way. And I think what this tool, this individual deprivation measure, ideally offers is a way better to understand the impact of poverty at the individual level, at the sub-household level. Most poverty surveys and poverty studies are undertaken at the household level and throughout the world, not just in Indonesia. It's quite, that's the way surveys are done. But that often tends to miss the impact on individuals, women, people with disabilities, other people who are facing particular challenges, who face particular poverty and deprivation challenges. And this measure, I think, alongside other measures, it's not the only measure, I'm sure, but alongside other measures, does help us to better understand the detailed impact of poverty and will help researchers, I think, and also policymakers at both national and local level to understand how to better tailor their poverty reduction programs. Now, the Australian government has already been working for a long time with the Indonesian government through TNP 2K, for example, through the Vice President's Program for Accelerating Poverty Reduction, through our Mahkota program, on work like the Unified Database and other programs which have helped to develop a better picture of who are the most poor people in Indonesia, so that assistance, both monetary and non-monetary assistance, can be targeted towards the most poor people who really need it. And this is vital because we all know that all countries, and including Indonesia's, funds, resources, budgetary resources for social assistance are very limited. And we've seen during this crisis that there are very challenging issues when you get new poor people and newly poor or people who are falling back into poverty, how to address them. So data about who are the poor and how to better target resources for those people is really critical. So I think that, again, individual, more granular measures of poverty, in addition to the other measures worked together, can ideally help us and help the government of Indonesia and other governments to better target their poverty reduction assistance and resources at those who are most in need, and begin to think in more detailed and targeted ways from the national to the local level about how this can be done effectively. I'd like to very much thank our program partners through Compact, which is the program undertaken by the Australian government with the Indonesian partnership at the decentralised government level. The program works at the Kabupaten and Kecamatan and even at the desa level to better provide a range of social and other services to people right at the grassroots. And I know that Compact has been quite engaged with the research team who've been working since 2018 to undertake the survey and to work at that local level to make the survey process effective. So I'd very much like to thank Compact, to Anna Winoto and all her team, both at the national and local level. And I'd very much like to, while this is a very joyous occasion, I would like to pay respects to one of the really important people in East Java. And I know this study was done in South Sulawesi, but Pak Bob was the team leader of Compact in East Java, and a very great colleague for everybody. And I met him when I was there last year, and sadly he passed away during August as a result of contracting COVID-19. So I'd like to pass on all of our condolences to his family and everybody for that, because he had made a tremendous contribution to Compact's work in East Java and to the whole program of Compact at the national level. But this, as I said, this work was done in South Sulawesi, in two Kabupaten, I think in Jeneponto, which, as you know, is south of Makassar, down at the sort of the southern point of that bit of South Sulawesi, and then also in Pangkep, which I think is the Kabupaten, which also includes a lot of the offshore islands, you know, that are offshore from Makassar there and all around the offshore islands there. So, so there's quite interesting and challenging terrain to do this research in. And I'd like to, you know, congratulate the researchers for the work, for the concept, and for all of the work that was undertaken to do this research. So I think that's enough from me. I know that our gender branch in Canberra, which was the original funder of this research, has been very excited by all of the work that's been done and the findings. I think there's a lot of expectation and hope that this will help to better get at some of the gendered dimensions of poverty and better understand those. And I think for us, more broadly in the bilateral program, the Australia-Indonesia program, I think again this underlines the real importance of knowledge development, the development of new tools, the provision of expertise that then the Indonesian, that Bappenas and the Indonesian system adopts and then picks up and uses. And I know, you know, Dr Maliki in particular is very interested in this kind of detailed analytical work and how it can be applied very practically to Indonesia's development challenges. And it's my pleasure in that context to, I've been asked to introduce Dr Maliki to you. He's the, as I said, he is the director for the Echelon 1 responsible for poverty reduction and social welfare at Bappenas. And previously, he held the role as Director of Population Planning and Social Protection and Director of Labour and Employment Opportunity Development also at Bappenas. He holds a PhD in economics from the University of Hawaii and a master's degree in industrial engineering from Purdue University. So very much an American educated gentleman, and also a Bachelor of Chemical Engineering from Bandung Institute of Technology. But although American educated, we in the Australian side work very, very closely with Dr Maliki and have done for many years. And we've worked closely with him on a range of social protection, decentralized governance, knowledge to policy, and also on through our partnership with the World Bank, which we then undertake with Indonesia. So it's a great pleasure today to welcome Dr Maliki and hand over to him to formally launch this individual deprivation measure of poverty study report for Indonesia. So over to you, Dr Maliki. Thank you.
Thank you, Pak Alastair, for your kind introduction. Distinguished panelists, Professor Sharon and Ibu Angie, also Pak Ansariadi dari Unhas. Distinguished Chair, my teacher, Ibu Nina Sardjunani. Distinguished participants, ladies and gentlemen. First, let me express my appreciation for the opportunity to launch the report of the individual deprivation measures study in Indonesia. Selamat pagi, good day. So let me begin my presentation by explaining how the government agenda to meet the SDGs goal, accelerating the zero extreme poverty achievement, responding to the effect of the pandemic COVID-19 to our single-digit poverty, and also recent agenda for the social protection reform can actually strategically be achieved by understanding the nature of the multidimensional poverty. So the more we understand, I think the more we realize that the need of alleviation of the chronic poverty with multi-sectoral approach. So Indonesia has, I think Pak Alastair already mentioned earlier, has achieved a remarkable poverty declining in the last 3 years. So we have reached the single-digit poverty rate in 2018. At that time, the extreme poverty was like 4.6%. So we also managed to reduce the inequality by pressing the Gini ratio to around 0.38, compared to its peak in 2014, around 0.43. So this achievement became a strong base for achieving the SDGs target in 2030. Therefore, just right before the pandemic COVID-19, our president directed our minister to formulate strategic planning to achieve zero extreme poverty in 2024. So this means like 6 years earlier that has been scheduled for SDGs goal 1 to in 2030 to achieve the zero extreme poverty. But after that, the outbreak of novel coronavirus threatens Indonesia's entire gain in reducing poverty. In just 2 months, the positive cases of COVID-19 has risen to more than 10,000. And now I think it is more than 200,000 cases. So the COVID-19 pandemic has declined the economic growth due to the large-scale constraint of people's physical mobility. Restricting the labor force activities and also economic production, which lowering down people's income. While all economies are more or less affected, the crisis will hurt most of the poor in developing countries. So our estimation in Bappenas, we have 2 scenarios: without and with additional intervention of social safety nets and also economic recovery programs. Without intervention, the poverty rates could reach as high as 10.6% or around 28.7 million. which means that there will be another 4 million new poor by the end of 2020. On the other hand, with policy intervention, the poverty is expected can be as low as like 9.7% or around 26 million poor people, higher than the figures in 2019 September. So this means that the social safety nets could potentially keep around 2 million people from falling into poverty. These past 4 months after this pandemic COVID, we have learned from the implementation of social assistance to respond for the pandemic COVID-19. We still have quite strong challenge to identify the right households or population to receive the assistance. As Alastair also mentioned, data is quite important. So our data is still more or less like favorable to vulnerable populations. So all the persons who live alone, for example, households head with disability or female head, or with like female head with disability, like among the invisible in the beginning of the pandemic COVID-19. So we learned like for the 4 months, how we can like slowly identify those individuals. We know that the poverty is multidimensional, and to tackle the problems, there are several challenges to be considered. Bappenas is mandated by the president to develop Indonesia social registry, which hopefully can cover up to 100 population by 2024. So the accurate data is needed to target the poorest of the population. Coordination among stakeholders is also crucial to ensure the programs are well integrated. So another important aspect is the sustainability of the funding, as well as the complementary between the social assistance and also the economic empowerment programs. So the last but not least is an adaptive social protection. We have learned a lot from the current pandemic that ASP is crucial to mitigate and also to minimize the effect of disaster problems. So if we analyze the vulnerability of one population based on their life cycle, we see that each age group has their own risk in every dimension, which can include education, health, technology, and also employment. So for example, school-age children with disability will have like less access to technology. Therefore, especially during the pandemic COVID-19, these children are more vulnerable to be less perform academically. They don't have at all have access to technology, and thus they will not, he will not access to the education as well. So in the longer term, they will not be able to compete for better and also more decent job. This is not to mention if we disaggregate the vulnerability based on gender, as well as place of residence, which is being like female with disability living in the rural areas can be the most invisible. So therefore, learning from the experiences and also moving forward for recovering the people's welfare, we are formulating the social protection reform in our annual working plan in 2021, and we'll like working until 2024. The social protection reform aim to anticipate the increasing of poverty rate due to the pandemic COVID-19, and also accelerate the poverty alleviation so that we can achieve the zero chronic or extreme poverty in 2024. I know it sounds like impossible, but I think among the 6 strategies on the reform, hopefully this can be possible. So one is data transformations. This can be towards like a social registry as the priority step in 2021. We have like national-wide updating the data and also increasing the coverage into like 60% of the population, the poorest population. And in 2024, we hopefully can cover the whole population. So our objective is that our data is more inclusive, because it is necessary and also become important pillar to alleviate the chronic poor. So secondly is the integration of the program. This is to ensure the multidimensional deprivation issues. By integrating social assistance and also basic services provision, we aim to strengthen the poor with multidimensional strategies. So in order to answer the issues, along with our social protection reform, we also indicate and also introduce a strategy of SDGs Goal 1 into multidimensional poverty indicators. So we put three main dimensions, which are health, education, and also the quality of living deprivation. This is actually proven to be the most strategic indicators in which today's launch of the individual deprivation measurement will show. So I guess the survey that have been done by the team has shown that the multidimensional approach can be a very strategic issues for us. So for examples, that the health deprivation is emphasized on nutrition status, which is the percentage of undernourished children. We also count for how many of the children population already have completed the basic immunization. Along with education attainment, we can indicate how far the poor and also the vulnerable quality compared to the non-poor. So this way, these measures will be very critical if we can identify the deprivation indicators by economic status, gender, or also place of residence. Further, deprivation is also about the quality of life, which can have a quite broader definition. So as an initial, we are also looking forward for more inputs. Deprivation is to access basic facilities experienced by the vulnerable children can be one of the main factors for them to fail achieving high productivity in the future. So therefore, access to sanitation, clean water, and also even I think birth certificates as the gate for everything can be an essential factor for gaining a better life. So therefore, we realized that when we attempt to accelerate our zero extreme or chronic poverty by 5 years, multidimensional deprivation become very critical. The indicators should be a base for integration of multi-sectoral programs intervention. In addition to the program integration, multidimensional program intervention, I think, can be realized by achieving the key factor policies. As I already earlier mentioned, is comprehensive updating the data. And then we also need to strengthen the local government capacity for both improving the quality of data as well as developing efficient and also effective intervention. And the third one is integration. So building stronger collaboration and also integration between programs, which are like social assistance, basic services, as well as economic empowerment, will ensure more holistic intervention, tackling multidimensional deprivation for all vulnerable groups. So we consider the multidimensional deprivation approach will be the key to achieve the zero extreme poverty. So along the way, reforming the social protection into more comprehensive and adaptive system is our vision. Maybe it's like in early slide, Fiska. So along the way, reforming the social protection into more comprehensive and adaptive system is our vision. Conceptually, our social protection will be consisting of more adaptive and more focused social assistance. Comprehensive also nation-wide of the social insurance and also stronger social services. So along with those programs, we also have to provide multi-sectoral basic services. We'll be ensure to provide higher human capital for all populations. So moving forward, we realize that in order to achieve the target, we don't do business as usual. There must be breakthrough and innovation. We hope the development individual deprivation measure could be one of the ways to comprehensively assess the individual condition of deprivation, which help the government of Indonesia to formulate the right strategies. And also the right policies and also the programs for the poverty reduction, especially for the poorest population. So lastly, congratulations for the team, Professor Sharon, Ibu Angie, for delivering the report of the individual deprivation measure country for Indonesia. So Herewith, we officially launched the report, and we hope that this research could benefit to all of us to accelerate achievement of our SDGs target. Thank you.
Thank you very much, Pak Maliki, for the comprehensive presentation on the program and strategies to tackle the impact of COVID-19 to poverty eradication and the introduction of the holistic interventions that will be started next year. I think this is a very excellent program that Bappenas and the ministry as well as the government is going to do. And what is really good to hear is that this holistic approach will tackle the multi-deprivation of poverty. So this study really helps Pak Maliki to clarify the issue and to having a better policy in the next future, so that 2024 zero poverty could be attained. And what is also important, what Pak Maliki said, this holistic approach is also to address the goal 1 of poverty of SDGs, that is to eradicate poverty, to be zero poverty in 2030, despite of this COVID pandemic-19. I'm going to invite Professor Sharon and Dr. Angie to provide the overview of the study. We are I'm keeping the time and we are still on time. I would like to introduce who Professor Sharon is. Professor Sharon is from Public Policy at the Crawford School at the Australian National University, and she is also the director of the Poverty and Inequality Research Center, along with the Associate Professor Janet Hunt, who is here. Professor Hunt, it's a pleasure to having you with us here today. And Professor Sharon has led this research on multidimensional poverty since 2008. So it's more than a decade. She has been dealing with this important issue. And she co-led the Indonesia study with Dr. Mandi Yap and Dr. Angie Bexley. Now, who is Ibu Angie or Dr. Angie Bexley? She's a senior research fellow at the Poverty and Inequality Research Center at Crawford School of Public Policy at the Australian National University, and she led the writing of the descriptive analysis for Indonesia country study report. So there are a number of reports because I think there are 8 countries, right, involved in this study. And Ibu Angie writes the analysis for Indonesia. And Ibu Angie has worked on poverty and social inclusion across the Australian aid portfolio in Indonesia. So she's going to be an Indonesianist one day as well, like Pak Alastair. I would like to invite these two very knowledgeable person on the study to present the overview of the study. I mean, the floor is yours. You have 15 minutes to present this.
Selamat pagi, teman-teman di Indonesia.
Selamat pagi, Bu Sharon.
And good day to friends in Australia and elsewhere. Thank you so much for the opportunity to share this work today. We had very much hoped that this event would take place in Jakarta and in Makassar, but sadly that's not possible. But we are grateful to the technology that we can be connected in this way. I would like to begin by acknowledging the traditional owners of the land on which I'm speaking from, the Ngunnawal people, and pay my respects to leaders past, present and emerging. I would like very much to thank Dr Maliki for launching these reports. This means a great deal to us, and we do hope that the findings of the study contribute to that incredibly important work that we've just heard Dr Maliki outline. And in undertaking this research, the one thing that we intended was that it would be useful to poverty alleviation and to social protection initiatives. Thank you to Ibu Nina for facilitating today. We are privileged and delighted to have you here with us. And thank you to Alastair Cox, Chargé d'Affaires, the Australian Embassy in Jakarta. And indeed, we are incredibly grateful for the support of DFAT throughout this research. The study that we are sharing today is based in 12 years' work. It began in 2008 with the goal of developing a just and justifiable measure of poverty, driven not by existing data, not by the priorities of experts, but grounded in the lives, the daily experiences, and the priorities of women and men living in poverty. A measure of poverty genuinely able to reveal gender disparities. A way of measuring poverty at the individual, not the household level. And that research resulted in the individual deprivation measure. During the past 4 years, we have been able to build on that early work and to test the individual deprivation measure in a range of contexts and countries, including in Indonesia. The IDM program was a partnership between the Australian National University and the International Women's Development Agency, with funding from the Australian Government through the Department of Foreign Affairs and Trade. At ANU, we had an incredible team of talented researchers who put heart and soul into developing a measure of multidimensional poverty that can contribute to the information we need to end poverty in all its forms everywhere and for everyone. I particularly want to acknowledge Associate Professor Janet Hunt, who co-directed the program with me, and Dr. Mandy Yap, who is here today, who was central to the study in Indonesia. And to also acknowledge Dr. Masood Hassan, who also is here today and undertook much of the statistical analysis that Angie and I will be talking about today. With the end of the IDM program in June this year, we have renamed the measure as the Individual Measure of Multidimensional Poverty, which better describes precisely what the measure is and what it does. Our research continues as part of a broader program of research within the Crawford School's Poverty and Inequality Research Centre that I'm privileged to direct with Professor Budi Resul-Sudarmo. So what I would like to do now is to just talk you through what the measure is and then to share with you some of the high-level findings before handing to Angie to take us into a little more detail. So in undertaking our research, we've been influenced by the thinking of Ruth Lister and her work on poverty. Lister argues that to understand and respond to poverty, we need conceptual and definitional clarity. We need to clearly conceptualize poverty, define it, and then be clear about what we are measuring, how, and why. We conceptualize poverty as being both material and non-material, social and relational, shaped by gender, generation, ability and disability, geographic location. We conceptualize it as scalar rather than being a binary poor, non-poor cutoff. And fundamentally, we see poverty as a denial of human rights and human dignity. This conceptualization is not our own. It is based on our research with over 2,000 women and men living in poverty across 18 sites in 6 countries, including Indonesia. And from this conceptualization, we define poverty as the interplay between material and key non-material deprivations that prevent an individual from participating in her or his own society and living with dignity. And from this, we developed the IDM, now the IMMP, in order to measure multidimensional poverty. We assess across 15 dimensions, 14 of which contribute to the measure itself. We're not currently including violence in our analysis, and I can talk more about this during question time or in follow-up emails if people are interested. Not all of these dimensions are necessarily caused by, cause, or represent poverty in and of themselves. But when deprivation is experienced across multiple dimensions, the resulting interactions create multidimensional poverty. From this, we are able to gain deep and nuanced information on the nature of multidimensional poverty. There are 4 dimensions of this measure that assess aspects of poverty that are specific to women. And in designing this measure, we've taken great care to be sure that we are sensitive to gender, but that we don't miss those things that are absolutely fundamental to women that are often not measured in many mainstream measures of poverty. In the health dimension, we assess women's access to prenatal care. And in the sanitation, relationships and clothing dimensions, we assess the ways in which access to sanitary products during menstruation impacts on and shapes women's experiences of poverty. And I think Angie will say a little bit more about this when she does her presentation. From one or more survey questions, we compose variables, which are then combined into indicators, aggregated into themes, and then to dimension scores. Dimension scores are aggregated into the IMMP or IDM index. Dimension scores are valuable in illuminating the broad patterns of poverty, as I will show in just a moment. Analysis of descriptive statistics at variable, indicator, and indeed theme level provide deeper insights into the nature of multidimensional poverty. And Angie will give you a sense of this richness shortly. We use a scalar approach rather than a binary poor, non-poor cutoff. We use a 4-level scale. And because we're interested in poverty, the bar is set very low. Those who are in the least deprived category may experience some level of hardship, but we don't differentiate within this broad category. Those in the deprived, somewhat deprived, and most deprived categories are experiencing very significant poverty, and those who are in the most deprived category are in real trouble. A unique and important feature of the measure is that we measure, as Dr Maliki has already noted, at the individual, not the household level. We randomly select enumeration areas and then randomly select dwellings, which may include multiple households. A short survey of one person within the dwelling identifies all households within. A short survey is then conducted with one knowledgeable person for each household. Here we assess issues that are genuinely at household level, such as energy and water source to the house, and we also identify all household members. And for individuals under the age of 16, seek parental consent. Under the age of 18, I should say, we seek parental consent. We then interview every adult member of the household, and in Indonesia, this included everyone above the age of 16 years. The individual survey is at the core of the measure. It takes about an hour to an hour and a half to enumerate. And independent evaluation of the measure found that interviewing all members of the household does not produce redundant information because members are sufficiently different from one another. And we're seeing those differences through this measure. By assessing the multidimensional poverty of individuals, we're able to determine how poverty impacts differently on different individuals and on specific social groups. We're able to identify how different social characteristics, age, disability, location, and of course, gender, intersect and often deepen poverty. In these ways, the measure is both intersectional and pro-poor. The measure is designed to be relevant to policy and to programming. The information produced is able to inform which social groups are especially multidimensionally poor, where targeting is likely to be most effective, where services need to be strengthened, where infrastructure, particularly social infrastructure, is lacking. And so now to turn to the headline findings from Indonesia. The study that we undertook in Indonesia was conducted, as you've already heard, in 2018 in South Sulawesi, with over 5,600 individuals. The data were collected by the amazing team at SurveyMeter Ibu Bondan, Ibu Wayan, and Pa Eddie are with us today, and I really do want to take this opportunity to acknowledge their outstanding work and to thank them very much. The reason that we have the rich data we do from the islands is because some of those incredible people from Survey Meter were prepared to spend 20 hours in a boat getting to the most remote locations. I also just want to take this opportunity to thank Dr. Ansariadi from Universitas Hasanuddin, who is with us today and on the panel. Without Dr. Ansariadi's support and advice, we could not have done this study, and we are delighted that our collaboration continues. I also want to thank Pa Amar from Compark and his incredible team, who really did make this happen and facilitated our engagement with stakeholders at local government level. So Pa Amar and team, thank you so much. And so to briefly provide some insights at dimension level. Overall, we found that women are more likely to be multidimensionally poor than men, with more women than men in the bottom 3 quartiles of our sample. We also found significant differences between women and men across all dimensions and at indicator level, and Angie will say more about this. So we're not necessarily seeing the clear feminisation of poverty, but we are clearly seeing the gendered nature of poverty. The differences between women and men often reflect gender roles and responsibilities, and indications are that some of these issues are likely to be exacerbated in the context of COVID-19. What you can see on the screen in front of you is the distribution of men and women within each of the 14 dimensions. And what you can see here is that more women than men are most deprived in 8 of the 14 categories, those that are highlighted in red. You may also note, this is quite small, I'm conscious, but you may also be able to see that in the family planning dimension, slightly more men are in the most deprived category than women. So the family planning category assesses unmet need for contraception. This is quite interesting, as unmet need is rarely measured for men, and we can see here that there is considerable unmet need for men. However, almost 20% of women in the most deprived category is of concern, and of course, the implications and consequences of unmet need for contraception are far more severe for women. Here you can see the food dimension, and here we see more women than men in the bottom 3 categories, although slightly more men in the most deprived category. But when we drill down, we find important gender differences. Men were more likely to miss a meal during the day, likely because of the nature of their work. Women were more likely to eat a limited range of foods and to experience anxiety about food shortages, likely reflecting women's responsibility for ensuring that their families are fed. And of course, these findings are particularly important again as we think about responses to COVID-19. Time use was the dimension where we see the greatest gender disparities, with women far more deprived. Women's long hours, unpaid domestic and care responsibilities, and multitasking due to the care of children is considerable. And this is of particular concern in the context of COVID-19, where we know that we are seeing women's time burdens increasing. And here we're likely to see women's levels of deprivation deepen. I wanted to share with you just a little on the sanitation dimension, largely because this is so relevant in the context of COVID-19. What's striking here when we look at sanitation is the bifurcation, with the high proportion in the most deprived category and in the least deprived category. Here, we drill down just a little further in the sanitation dimension to look at the theme on access to water and soap for hand washing, which of course is so critical to COVID-19 responses. And here we see very stark differences between rural and urban areas, particularly in that most deprived category. Here we see the education dimension, with more women in the most deprived category than men. what you see in front of you is one of the two themes in our education dimension, educational level. And here we see educational level across age groups. So what we see here is Indonesia's great success story, as access to education has been dramatically increased for both girls and boys over time. A critical feature of our approach is that we go beyond access and we go to quality and to outcomes. In the education dimension, our second theme focuses on educational outcomes by assessing very basic functional literacy and numeracy. And here we see some ongoing challenges. With almost 20% of the youngest cohort, that is the group aged between 16 and 24 years, in the most deprived category. So that perhaps gives you something of a high-level overview of what we see at dimension level through the IDM. I also just wanted to share with you a little about an accompanying survey, an accompanying piece of research that we undertook alongside the survey. This was a qualitative follow-up study using interviews to understand people's experiences of participating in the survey. So this phase of the IDM program was about testing the measure. And one of the things that we wanted to do, alongside ensuring that it provides gender-sensitive, robust, policy-relevant information, is to ensure that it's safe and ethical, and to understand the way in which respondents to the survey experienced it. We also wanted to follow up with people that had participated in the survey about their experiences of answering questions on violence, and to ensure that there were no negative unintended consequences of asking those questions through a survey. This study was led by an outstanding team of Indonesian researchers led by Clara Siagian, who's also here today. And I did want to thank Puskapa at the University of Indonesia for their support of this study. The follow-up study gave us an understanding of how participants felt about answering the questions, some of which were quite personal, and was something of a relief to us. The follow-up study indicated that no one experienced negative impacts as a result of participating in the survey. It also indicated the depth of poverty some people experience, and we gained some knowledge of that through a survey. Qualitative research often gives us even deeper insights. In regard to violence, it showed a couple of things that I think are quite important. First, people experiencing violence in any form spoke of deep isolation and often of keeping their experiences secret or to themselves. And second, there were very few supports and services available for people experiencing violence, including domestic violence. And this was particularly the case in rural and remote areas. Strikingly, social supports as well as formal services were often absent. So just to summarise our headline findings, poverty is gendered, with slightly more women multidimensionally poor than men. Multidimensional poverty is also different according to geographic location. It is fundamentally shaped by age, and people living with a disability experience very deep multidimensional poverty. Angie is now going to take us deeper into the way that different social characteristics intersect to deepen multidimensional poverty, and to talk us through a little about how dimensions interact for some groups, including people living with disability. Thank you so much, and I'll hand over to Angie.
Ibu Angie, please.
Thank you, Sharon. I'll try to share my screen. If it works. All right. I think it's there. Selamat pagi, salam sejahtera bagi kita semua. Thank you to our distinguished panelists. Thank you, Pak Maliki. Thank you, Pak Allaster, and thank you to our distinguished chair, Ibu Nina. And thank you all for joining us here today. So Sharon has provided you with a picture at the dimension high level. Now I'm going to take you drill down to the indicator level, which allows us to see which subgroups of a population are multidimensionally poor, and we'll look at the range of, at this micro level, the range of indicators. Today, I'm going to focus on the intersections of location, age, and disability. The data collected can be analysed in different ways and respond to local policymaker needs. For example, in Pangkajane, policymakers were very interested in looking at the difference within their one kabupaten. This kabupaten covers the mountains, the lowlands, and the islands. Next slide, thanks Sharon. Here we are, here's the regional population sample breakdown. And I'm going to take you through just some of the key findings of these regional differences, particularly the isolated areas of the islands regions in relation to health, food, water, and sanitation, and just give you an idea of some of these key gender differences. On to health. On indicators of health problems and problems with healthcare, women and men in the islands were significantly more deprived than in the lowlands and the mountains. Almost 40% of respondents in the islands reported having one or more health problem, compared to 26.3% of respondents in both the lowlands and the mountains. But despite higher reporting of health problems, women and men were the least likely in the islands to have accessed healthcare in the past 12 months. These problems included the location of healthcare facilities access, the cleanliness of those facilities, and the availability of drugs. When we look at indicators across, on the next slide, thanks Sharon, thank you. When we look at across the indicators of food, water and sanitation, the same patterns of deprivation starts to emerge for those living in the islands. The first graph here shows one of the indicators on food, where we can see over half of men and women in the islands were worried about running out of food because of a lack of money or other resources. This is compared to 36% in the lowlands and 33% in the mountains. Similarly, with water, men and women in the islands were more likely to report using water from untreated sources for drinking water and household use. The second graph here shows that collecting water for the household is by far a greater issue in the islands. Sanitation, as Sharon was saying, is much more of a problem, and we can drill down to see exactly where. Here in the islands, the third graph here shows this stark difference. Almost 55% in the islands had no toilet facilities at all, compared with 12% in the mountains and 7% in the lowlands. The final graph here shows that almost 60% of people in the islands had no place to wash their hands, compared to 12% in the islands and 2% in the mountains. Slightly more women in the islands were responsible for water collection and were more likely than men to experience threats or hazards while performing this task. So on to the next slide. We can drill down to, as Sharon was saying, we also look at questions of menstruation in the dimensions of clothing, relationships and sanitation. And here we can see clearly these regional differences where women in the islands are most deprived across access, participation issues and privacy. So the IDM really allows us to drill down to this indicator level to better understand the particular experiences of poverty and how they are playing out differently for women and men, and also across those different locations. On to age and gender. Our data also revealed the gendered and generational patterns of deprivation. We see that all age groups experience deprivation, and that different deprivations are more acute across the different stages of life. The study used the Indonesian age categories, 16 to 24 years, 25 to 49 and over 60 years, sorry, 25 to 59 and over 60 years. On to, we can see for young people, deprivation was characterised by uncertainty over housing, a lack of voice and poor mental health. Young people were most likely to fear eviction and felt their concerns would not be taken seriously. While more young women than men reported having concerns within their local communities, young women were far less likely than young men to feel able to raise their concerns or to think that they would be taken seriously. They also experienced higher rates of feeling worried, nervous or anxious on a weekly basis. When we look at the middle age, as Sharon has already discussed, we can see the same thing from going to the high level down to these indicators, that for women, particularly those in the middle age cohort, poverty is characterised by time burdens and food insecurity. Women in the middle age cohort carry the greatest burden for unpaid domestic and care work, regardless of whether they are in paid employment or not. Women in midlife are more likely than any other age group to report being worried about running out of food, and they are also more likely to restrict their own diets due to a lack of money. For the elderly, people over 60 years of age are a particularly vulnerable group in society. Weak social support can lead to isolation, which can compound poverty for this group. Our data down at the indicator level reveal that older women in particular were least likely to be able to return a favour, to attend or contribute to a community event. Older women were also least likely to have everyday and formal clothes and footwear, which impacts on how they're able to contribute and participate in community events. Older men were most likely to report not having enough energy supplies to meet their lighting needs or to have sufficient fuel to meet cooking needs. So when we look at all of these indicators and then up to the dimension level, when we're measuring at individual level, we can begin to see how different deprivations affect groups as they progress through the life course. And the strengths of this descriptive statistical analysis is that we can drill down from a high level down to exactly which indicators in which dimensions are changing over time. I'll just speak shortly, briefly on people with disability. So people with disability are often the invisible group in poverty assessments. When they are included, the data is often not sex disaggregated. Indonesia is comparatively rich when it comes to data on poverty, and we know that people with disability have lower monthly expenditure per capita, lower educational attainment, fewer economic opportunities, reduced access to services. And what this study does is aims to provide additional and complementary information by providing nuanced and sex disaggregated data on multidimensional beyond access and service issues. So this study used the Washington Group short set questions to screen for people with disability. And the study I'll be talking about today was in Jeneponto and identified 306 people with disability. So although these are relatively small numbers, these findings bring to light the gendered aspects of multidimensional poverty for people with disability, and more investigation on these issues, for example, through a purposive sample, would be really beneficial. We can see here the main finding from this study at the indicator level illustrates that people with disability experience poverty more deeply than those without disability across most of the indicators across all of these 14 dimensions. The findings also show that men and women with disability experience different deprivations and that women are particularly deprived. When we look, for example, at people with disability and work, we can see down at the indicator level that people with disability are working long hours and experiencing heavy time burdens. People with disability are working just as much, if not more, than those without disability. The graphs here starting on the left show people with disability are doing more unpaid domestic work and care. The second graph there shows the percentage of time people have worked with a child in their care. So more people with disability than those without have a child in their care when they're doing other duties. And the third graph there shows people with disability are slightly more represented in the informal sector. And this is particularly relevant given that people in the informal sector have been deeply affected by the current economic crisis caused by the pandemic. The fourth graph there shows the typical paid work hours. And so while there are less women with disability in paid employment, when they are typically working half an hour longer than women with no disability. It shows women with disability working 6 hours in paid work and women with no disability working 5.5 hours in paid work. When we look at food, what's really worrying here is that despite these high levels of contribution in paid and unpaid work, our data shows that people with disability were more likely to experience food insecurity across all of the 8 variables within this food dimension, and women with disability were more deeply deprived. When we turn to health, our data revealed that the poor health status of people with disability with greater reporting of physical illness and injury, and also higher rates of worry, anxiety and nervousness, people with disability were more likely than those without to have sought medical care during the past 12 months, so access is actually higher, but they are also more likely to report more problems with the nature and the quality of healthcare services. For example, women with disability were more likely than any other age group to report not being treated with respect by medical staff. So the picture here is a particularly concerning one for people with disability, particularly women with disability. The data tell us women with disability were working long hours, often in the informal sector, had significant caring responsibility, were food insecure, and did not have quality health care. So by collecting data at this individual level, the IDM reveals which social groups are experiencing multidimensional poverty. We can see the big picture in terms of the dimension level, and we're also able to drill down to look at some of these indicators to see the nuance and some of the richness of this data. The IDM is designed to provide policy relevant data and can be used to complement existing data sets in Indonesia and focus on the key priority groups that Dr Maliki was talking about initially, women, those living in isolated areas and across the life course, including the elderly, and men and women with disability. And on to the second last slide, I think it is. The UN Transforming Our World resolution adopted by global leaders to usher in the SDGs stated that we recognise that eradicating poverty in all its forms and dimensions is the greatest global challenge and an indispensable requirement for sustainable development. We hope the information that this measure provides can assist in meeting that challenge. Thank you. And I will land here on our resources page. We have a whole host of fantastic resources in English and Indonesian, including some great short animations. And I will now hand the floor back to Ibu Nina. Thank you.
Thank you very much, Ibu Sharon and Ibu Angie, for this wonderful a study that reveals a lot of data that we haven't even explored this deeply before. And this is, I think, timely with what Dr Maliki is going to do next year. Now, even though we are a bit late, but I would ask the apology for being a bit late, but it's going to be okay. And I will, this is now, we are entering into the question and answer. I would like to invite His Excellency Pak Allaster to address a question to this very comprehensive and to me is a rich study because it demonstrates the interlinkages of multidimensional poverty. Pak Allaster, the time is yours, Pak. Pak, you may have to unmute that. Okay.
Very much, Nina, for that opportunity, and thank you very much to Dr Maliki for his overview, and to Professor Sharon and Angie for the presentation on the key findings from the work in Jeneponto and Pangkep, and as you said, Nina, the great richness of the detail of the data and helping to define what are really some of the key poverty challenges in different communities and between genders and age groups. I was interested to know a bit, maybe also from the research teams, if poverty data like this in future in the coming decade or so is to be gathered by Indonesian government, local government or other partners, what were some of the real challenges of obtaining this data? I think Sharon spoke a bit about some of the, the issues about were there impacts, negative impacts from gathering this data, and clearly if local authorities are going to be able to start in the future and use it, what are some of the lessons learned about the way the data was being gathered, and how it, and then maybe also how do you think local authorities in future can use this data effectively to help them in their task of better targeting and designing programs to help overcome some of that? So, I'm sorry, it's a bit of a big question, but I was quite interested in, so it really is about scaling up. I mean, how do you envisage, or what do you see as some of the challenges to then scaling this up for other districts or sub-districts in Indonesia? How do you think they would go about that, and what would be some of the challenges they would need to overcome in undertaking that? Thanks.
Thank you, Pak. Ibu Sharon and Ibu Angie, please.
Perhaps I'll lead off with that. Thanks, Alastair. That's an excellent question to kick us off, and it kind of goes to the heart of where this can go from here. Just broadly in terms of scalability, we think that this has enormous potential to be scaled up in Indonesia, but also elsewhere, but I'll speak to Indonesia. The phase of work that we've just completed, as I said, was really around testing this approach to poverty measurement in different contexts, ensuring that it's robust, that it actually adds value, and that it's doable. And that program of work has clearly demonstrated that yes, this is doable and it does add value. We're conscious that in Indonesia there is very rich data, and we see this as being complementary to what already exists, because it does something a little different. And of course, Indonesia is better placed than many countries because it does have that long history of rich data. I think particularly at the moment in the context of COVID-19 and the challenges that you outlined, Alastair, and that Pak Maliki outlined, a nationwide study of this kind would be extremely beneficial. Of course, I would say that, but I think our analysis and our conversations with colleagues and partners have indicated that scaling up at the moment would be incredibly valuable in terms of demonstrating what the impacts are at the moment in terms of COVID-19 and providing us with data that we need to really know about as we respond and then ultimately recover from this crisis. In terms of the challenges of gathering the data, I'll just speak very, very briefly. Ibu Nina, stop me if I am being too expansive in my response.
Okay.
As I said, we did have that dimension around violence, which was important in the participatory research that underpins this approach. But we have a particular challenge because we interview with this survey every adult member of the household. There is a risk in the case of family, intimate partner or domestic violence that we are interviewing and asking the same questions of both perpetrators and victims. And that's one of the main reasons that we did the follow-up study. We found through that follow-up study that there had been no unintended consequences of that approach. We did have some participants in the follow-up study, some female participants, tell the researchers that they had lied to husbands or people in their household about their experiences of violence, that they had told the researchers the truth But they then said to husbands or others, no, I didn't tell them what happens. So this really speaks to the challenges of that dimension and to the importance of confidentiality. We're not continuing to ask those questions about violence until we've done some more testing, but we think something like violence or safety is very important. So we're doing more work around that. In terms of what's needed to do this, we need a good survey enumeration organisation, and I'll just give another shout out to the incredible survey meter here who do the IFLS and other studies in Indonesia. We have nearly 2 weeks training for this survey, so there is an investment in the training. A lot of that is around the violence, so the training would be a little shorter without the violence dimension and the violence questions. But I think for a survey, a multi-topic survey of this kind, that kind of training is really important to make sure that it's done robustly, that it's done ethically, and that the enumerators are really well supported. And so that's a really important investment. Beyond that, I think what we've demonstrated through this program and through the Indonesia study particularly is that this is achievable, it's doable at local level and it's doable at national level. It takes, as I said, that enumeration training and it takes some support, but so do all good surveys. So, you know, we think we've demonstrated that this is a model that works well. In terms of how local authorities might use this, we've done quite a lot of engagement with stakeholders and partners prior to the study. You know, we began that back in 2014, 2015, talking to people about the possibility of using an IDM in Indonesia before we actually had the funding to do it. And we've continued those conversations. Ansariadi, who you see on your screen now, is going to be leading a series of workshops later this year with local government in both Pangkep and Jeneponto, and also some workshops at provincial level in Makassar to work through with policymakers and other stakeholders about how this might be useful. And we're going to document that process by the end of this year. We hope we'll have lots of those learnings captured. I don't want to put Ansariadi on the spot because he wasn't anticipating speaking, but Ansariadi, if you wanted to add anything, you're very welcome.
Oh, thank you very much. And, yeah, thank you very much, Sharon. And it's really interesting to see your data, and definitely the question from Paulus that's really important about how the local government actually use this data and help them to formulate the program and policy in particularly at the district level. And we already decided 3 different series meeting with the local government, the government of Jeneponto, the government of Pangkep, and the government of Makassar. We are going to present this data and have group discussions how this data could help them to formulate the intervention in terms of poverty alleviation in district level, how this new information will probably add some new insight into the developing of programs that more focus on the gender and age sensitive in terms of poverty alleviation, and that will be interesting. And tomorrow I'm going to Jeneponto to initiate the meeting.
Wow.
We'll be meeting with Sekda Jeneponto tomorrow. And of course, the first meeting will be conducted on October, and through series meeting in Pangkep and Makassar. So over back to you, Sharon and Ibu Nina.
Thank you, Pak. Ibu Angie, you would like to add? We still have 1 minute. No? Okay. The question addressed by Pak Allaster, I think, is the core question and the hardest one to answer, because because to replicate this kind of intensive study is not an easy one, and it requires commitment and understanding of the local government, how important the study is, so that they can use the data for improving their policy and programs to tackle poverty, especially now during the COVID pandemic, situation. And I have I think I need to pick one question from the audience. I think the first question is already been addressed by Pa Alastair, how the plans to roll out the study across Indonesia. I think it's been answered very clearly. And who will collect the data? I think this will have to be underlined once more by Ibu Sharon. And the special training. I think this is really important. The special training to conduct the IDM survey to answer the question addressed by Pa Allaster as well. So how the capacity of the local government is going to be improved, and what university, I think university may need to be, a local university may need to be engaged so that they can help improving the capacity of the local government, like Hasanuddin University has improved the capacity of Pangkep and Jeneponto, right? And Universitas Hasanuddin is so famous for improving the local government capacity. I work with University of Hasanuddin quite a lot, also from this School of Public Health in Unhas. Professor Acha, Professor Fanny Haju, I think those are the senior professors who are working very hard to improve the capacity of the local government in the eastern part of Indonesia. Ibu Sharon, please, the capacity, how the training is going to be done so that it could be replicated nationwide. I think that's the core of the question. Please, Ibu.
I think, Ibu Nina, the training is really essential, and we need to think about sort of training, education, capacity building, knowledge transfer and sharing when we're thinking about this, and think about it in multiple ways. So I spoke a little about the importance of training the enumerators. When we were working with SurveyMeter, we were, of course, working with very experienced enumerators. Yeah. But this is a specific survey, so it needs training on this specific survey. Yeah. But I think we also need to think about knowledge sharing and knowledge building beyond just the survey itself. We need to think about how we work with local stakeholders and to work to address their needs to actually be able to use the data. You know, this survey produces a very complex set of data, a very rich set of data. And so the kinds of workshops that we've been doing already that were halted by COVID-19, but that Anchari is going to be picking up and doing and taking forward with local government is really important to building capacity and transferring the knowledge so that local stakeholders, local partners can understand how to use it and what it means. But as part of that is also the knowledge sharing, so that when we are talking about what the data provide, we're not just talking about it from our analysis in Canberra or even in Makassar, but sharing what that means in local context, so that what comes from it is useful and can be used by local stakeholders. So I think for this kind of measure to be most powerful, we kind of need a wraparound approach where we're working in partnership and collaboration to prepare, to collect the data, to analyse the data, and then to work through what to do with that. And of course, none of that is going to be successful unless there is really deep, genuine local ownership. And ultimately what we would love to see is for this to be taken forward in Indonesia by Indonesians, and for that knowledge sharing and knowledge transfer to happen without us.
Thank you. Now my time is already 10:40. We are about to close this workshop, but I need to have one question from Pak Maliki. Pak Maliki, you would like to address one question, please, Pak?
Yes, thank you, Bu Nina. Actually, there are two, Bu Nina, but one is
Oh,
not a,
okay.
because it's already addressed by Pa Alastair, and
Yeah.
I'm it's a bit twist. The question become what we call suggestion for collaboration, because actually the next challenge for us is on how we can scale up this survey, international survey. But actually, we have a lot of and rich surveys that have been done to the statistical office.
Yeah.
But I mean, the richness of this project is maybe have to be also elaborated in our existing survey. So
Right.
I guess for the future collaboration, Pa Alastair, actually, I would like to ask Anu also to discuss the possibility on how we can have or elaborate the existing survey that we have, and then we can have the richness of this survey that have been done by Anu can be applied to the our existing one, because you know that it can be a very valuable for us that connecting the dots of the strategy of the policy by having elaboration from our existing survey. As well as that, I'm very excited actually when Professor Sharon also suggesting on how we can building the capacity of the local government, because actually indeed what we are going to do next year is that we are going to have like nationwide updating of the data of our poor database that's belong to Ministry of Social Affairs, as I mentioned earlier. So we already collaborate with the statistical office. So then we are going to have capacity building for the local government. It seems like it will be very rich if this capacity building also incorporate with all the like social types of questions that have been explored by this project. You know, usually that the data that we have in the Ministry of Social Affairs is more to the conditions like physical conditions of the house. But there is some non-physical conditions actually that we have also to explore, and also the local government, as well as not only local government, but also the local communities, as well as the academicians that can collaborate in building this capacity. So I think this is quite thrilling. And as well as one thing that is I'm trying to connect the dot is that once the local government have the data, I think we also need to have capacity building on how they can use the data.
Exactly.
Pak Alastair already support us with Compact. Compact already support us with Sepakat. And Sepakat is one way for us on how we can explore this possibility. So we already have quite a lot of and also rich assets to begin with. So I guess we are going to use this, Pak Alastair, and also use Sepakat, how actually the government can elaborate, use the data as for like policy, evidence-based policy planning. Yeah. So this is something that actually very exciting. Lastly, it is a question, but you don't have to answer no, for Professor Sharon, because I think it seems like the time is quite up. I'm just wondering about the definition of the time deprivation. Yeah. Because when you say that the people with disability work longer than the people with with people with not disability, there's a lot of meanings with that. You know, I don't really mind if they work with unpaid workers, because it seems like we can also estimate the economic value. Also, how much they also care for the children, because we also can estimate the economic value. But something that maybe we have to explore is that usually people with disability will take time to go to the office. So this one is quite essential for us on how we can analyze this one. Because, you know, especially in the local context, in the island or in the remote area, there is no like infrastructure such to make them like easier to go to the worker place. So this one is like what I call inefficient time use. So I think maybe we can explore that, Professor Sharon. That's also one thing that really excites me about this this survey, Ibu Nina. We have quite a lot of things that we can explore, and also we can have a lot of things that as a base for our policy recommendation. Thank you, Ibu Nina.
Thank you. I would like to add, if I may, the violence that occur in the poor families is often hidden because it's a personal experiences, but it will have to be uncovered. And this aspect, the non-material poverty dimension, violence, Pa Maliki, I think may need to also be explored. It's not an easy one, I know, but this can be done together with the Badan Pusat Statistik. They have a special study on the experiences of women. Actually, it's the experiences of women to experience, all kinds of violence. And Puskapa, I think, is also one of the center that can help analyzing the data, because this data is very, very difficult to analyze. And what is also important is how could we then formulate an evidence-based policy on violence. So Pa Maliki, from the gender perspective, violence is, I think, one of the core in poverty that need to be addressed. If no more, or Ibu Sharon, you would like to, Professor Sharon, you would like to respond on what Maliki has said, and also my suggestion to explore more on the violence. Please, you have 1 minute to answer that, Professor Sharon.
I'll answer by saying, Pat Maliki, we are really keen to continue talking with you about this, particularly on the on the time use. Mandy Yap, who's in the audience, is doing some work on that dimension at the moment, and along with Firaman Wittela, who I think you know, who is now at ANU and was from Survey Meter. Some of the things that you spoke about the time taken to travel for people with disability, and some of those extra time burdens we perhaps don't fully capture, but we do capture, I think, more than any other multi-topic survey of poverty, things like on-call time, time spent both at work and then in non-work tasks, both domestic care and domestic work, but also the production of goods for vegetables and so on, food crops. So we cover a whole range of activities, and including voluntary work. To us, I think one of the really striking things about the time use was when we looked at it alongside the food dimension, and as Angie said, could see for people with disability that they were contributing significantly, but there was that level of food insecurity. So that kind of interaction, I think, is really concerning. But we would really like to talk to you more and draw on your expertise around that time use dimension particularly. Very briefly, Ibu Nina, yes, we agree absolutely. One of the concerns with the data that we've collected through this survey is that it tends to measure quite low levels of violence, particularly against women. We think that's because the violence prevalence studies take such a long time to kind of build trust and rapport and people feel comfortable responding. So we are very nervous about producing data that we don't think reveal the extent of gender-based violence, because that could be very undermining. So we're treading cautiously with this, but we do want to further explore this because, like you, we think that this is an absolutely critical dimension of poverty. So we'll continue this work, and we will take this as an invitation to continue to talk to you about it, as we also follow up with people like Santi and colleagues at Puskapa and elsewhere.
And that is relating to Goal 5 of SDGs as well as Goal 16 of SDGs. I think, and this is the hardest issue to address, because we only have one survey for the experiences of women.
Yeah.
Now, I think we come to the conclusion. We are going to end this. I have to really apologize that we extend this important workshop, but I think we learned a lot from this important study. The findings provided by IDM will be valuable to the government of Indonesia, like Pak Maliki has said, and also to help reporting one of the most difficult issue in SDGs, that is on violence. On violence, this is the most difficult report on SDGs. Not only goal 1, especially target 1.2, but also goal 5, and of course goal 10 on inequality, and goal 16, because goal 16 also address violence there. And the findings is, I think everyone, we all agree that the findings provide valuable information on the importance of quality services, not only the access, but quality services. And this is a new way of assessing poverty. Pak Maliki also admit that, because we are looking, the study looking at the individual level, and the individual, they are the ones to eventually say that these are the dimensions that are important for me. It's not the researcher, but the individuals themselves, so that the index can be developed based on the experiences of the poor, how they are encountering their life from time to time. And this is, of course, will help the government to address more quality policy programs. As I always said to Pak Maliki, we have to have evidence-based policy and programs to address all kinds of issues in our development undertaking. And what is important, Bappenas, Pak Maliki is going to start addressing the multidimensional poverty by implementing what if I may echo what he said, is the holistic approach of poverty dimension policy and programs. And this study is timely to help Pak Maliki to sharpen the policy, and to, like what Pak Allaster said, how then this study is going to be accelerate and escalate the study not only in two kabupaten, but we have more than 500 kabupatens and the variation will be very high, and it's very interesting to have this kind of data. But what is important, after the data is collected, how the data is going to be analyzed, and this is important. That will go into the policy formulation and program implementation. I should stop here by thanking once more to the distinguished speakers, His Excellency Pak Alastair Cox. Thank you so much for staying with us the whole workshop, Pak. We really appreciate that. And thank you, Professor Sharon, for sharing the result and the findings of this study together with Ibu Angie, because Ibu Angie analyzes especially the country study of Indonesia. And Professor Janet Hunt, thank you so much for also supporting this study. And what is more is the support from University of Hasanuddin, Dr. Ansariadi, who helped materializing this study, and the whole School of Public Health, I think, is very supporting to the study. And last but not least, to Pak Maliki, who will eventually use the data from this study, the findings of this study, to improve the policy for the next years to come. Thank you very much. We will again. Thank you very much, Pak Allaster. Thank you so much. Thank you, Professor Sharon. Thank you, Ibu Angie. Thank you, Professor Janet Hunt. And thank you. Terima kasih banyak, Pak Ansariadi, untuk dukungannya. And last but not least, of course, my beloved Pak Maliki. Pak Maliki, thank you so much for sharing your time. I know you are very busy during this time, but you are very so generous to be with us for the last 2 hours. Thank you so much, and we will see you again in the next workshop that will uncover more detail on the multidimensional poverty in Indonesia. Thank you. Stay safe and healthy. Bye-bye.
Terima kasih banyak.
Selamat siang.
Selamat siang.
Terima kasih.
Selamat siang.
Ibu.
Terima kasih. Matur nuwun, Ibu Angie.
Terima kasih Ibu Nina. Terima kasih Pak Maliki.
Terima kasih
Pak
Ibu
Maliki.
Sharon. Terima kasih Ibu Janet Hunt. And thank you so much, and we will see you again.